Hi everybody and welcome to our next episode of the National Counselling and Psychotherapy Conference chat. Today I have with me two very special guests. Both of them are from Singapore General Hospital. We have Nishta as well as Shi Min. Both of them are clinical psychologists. So without further ado, perhaps we start off with Nishta. Tell me more about yourself.
Okay, I'm actually a clinical psychologist. I'm working at SGH now. I've been here for about, I suppose, 6 years.
Mm-hmm.
Yeah, so that's just a little bit about me. Yeah.
Right, Nishta. What about you, Shi Min?
Well, I'm a clinical psychologist working at SGH too. And I am also a certified group psychotherapist.
Right, so both of you, did you guys start off your journey at SGH at the same time, or both of you came at different times?
Well, I just joined this year actually. I was working at the other hospitals in Singapore previously.
Right.
So I'm a newbie in SGH.
Okay. Well, Nisha, can you share us a little bit more, about your journey to become a psychologist? Most girls don't grow up thinking that, one day I'm going to be a psychologist, but you guys both have joined that journey and started that journey. Tell us what started you off on this journey.
I think for me, generally, I think growing up, I was quite interested in people around me. I think I spent quite a lot of time watching a lot of the people in my own family, because I was the youngest, I think I got to see a lot of people, especially being part of an extended family and how the dynamics kind of work within an extended family. So I was quite interested in people. I was interested in other people, especially in secondary school and stuff like that. And I'm not too sure what exactly it was, but I just gravitated towards working or talking to people, and I found myself out of the class more than I was in the classroom, or at least writing notes to other people. So I like that whole human interaction. And slowly, I think I gravitated a little bit away from the whole academic work. And I started to kind of see a lot of light in communicating with people. So that was where a lot of my interest seemed to lie. Just somehow I felt, okay, fine, let's do psychology. And then in time, I chanced upon clin psych. Yeah.
That's a really interesting story. So I just shared this with you, but earlier in my conversation with Kay or Karen, she's from the Philippines and she does a lot of interesting work back in the Philippines, helping children at risk, juveniles, as well as family members get back into the action. She shared with me her journey to become a psychologist, and actually part of the reason was because as a child herself, she underwent depression, she went through self-harm, and that started her off on this journey to become a psychologist. And so from her own personal pain experience, she became a help, a beacon of light to many people. So that's interesting. Thanks, Nishta. What about you, Shi Min? Tell us a little bit about your journey.
Well, I've always been really, my mom would call me a chatterbox since I was a kid. I've always enjoyed talking to people. And I think through conversations with people, I feel so rejuvenated. So I think it became a crossroads, after I'm done with my A levels and I'm lost of what to do as my major in university. And then I realized that I really enjoy talking to people. And I feel like if those conversations could turn into something that's therapeutic, helpful for other people, that would be wonderful. And I think that's how I got a lot more attuned to, really curious about psychology. And that's how the journey began. And yeah, so a fun fact, Nishta and I, we are both from the same batch of our masters. So we knew each other way back. Yeah.
Okay, that's so nice. And then now both of you are in SGH, so that's fantastic. Should we just back to you? You were conferred the designation of Certified Group Psychotherapist by American Group Psychotherapy Association, which is the AGPA. What does this mean for people in Singapore, SGH? Tell us more about the work you're doing.
Right. So, it's really an honor to be formally recognized as a specialist in practicing in group psychotherapy. Because to be certified, it requires to meet internationally accepted standards for training, education, and experience in groups. AGPA, it's an organization that's been around for the longest time, and to me, it's a professional home. As much as like, I mean, there are colleagues, there are friends that I do training and research collaboration over there. But a lot of times I feel like it's a professional home because people over there has been so welcoming in teaching and sharing. And it's a very humbling experience for me as a young therapist myself. I still think I'm still relatively young in this field. So so I think in terms of like being CGP, I think that comes with that professional accountability, as reassurance for the patients and my employers to say that, like, you know, the group services provided are really of a certain quality, I would believe. And I think my work with HEPA so far has come, like I mentioned earlier, a lot about training and research collaboration with the experts over in the States, as well as ongoing discussion. I think it's undeniable the fact that we have a lot of cultural differences, and in terms of like bringing that specialization of group psychotherapy and spreading the word in Singapore, I think we do need to recognize how culturally we are very different. And I think that's like an ongoing learning journey for both us and as well as HEPA.
Right, interesting. That's a very interesting journey now. Nishta, you too, you specialize in group process. Can you tell us a little bit about what group process is compared to, say, one-to-one psychotherapy? How is this better?
So I think at this current point in time, I'm actually receiving like supervision from Shi Min, because she's the certified group therapist. And I'm very thankful to kind of have her around, because then it makes room for a lot of us to kind of progress forward with regards to, you know, group psychotherapy, as well as specifically process groups. So this thing about process groups are actually, like sometimes some people would ask, right, like why process groups? Why not individual psychotherapy? Individual psychotherapy and process groups, there's research shown that individual psychotherapy and process groups, it's equivalent, the progress, you know, that you kind of get out of group psychotherapy as well as individual. So that's quite promising, you know. The other thing is, sometimes what individual psychotherapy cannot do, a group can do. So for example, sometimes patients might come in and they might say, oh, you're my therapist, and that's why, you know, you said this to me, or you know this about me, and hence you said that. But then within a group, you're hearing from other people in a group. And sometimes that can be quite corrective in a sense, because they are strangers. You may not know them beyond the group. So sometimes when somebody who's a stranger gives you feedback about yourself that is personal, and it has good weight, because there are several other relationships in which you have heard the same information, sometimes it carries some weight when you hear it.
Awesome. Interesting. Shi Min, back to you. For group process, do you feel that it's better across certain age groups, as in more people maybe in a younger age group more willing to you know, take part in group process, or do you feel that it's the older generation, or is there a difference at all between the two age groups?
Yeah, I think that's a really good question, Jamie. Whether there is any cohort effects in articulating emotions, right? Yeah, I think it's ongoing journey, and I wouldn't want to be too quick in making that assumption, because I think that's a myth. There are a lot of people who say that, like, oh, you know, in the Asian culture, you know, the older generation might not want to come together and talk about difficulties. They might want to celebrate things together, but not actually talk about difficult stuff. But I think through my experience, I do see there are patients or clients who are like much older and still being able to reap the great benefits of groups. Because I think the thing is, help me add on if need be, because I think we are all constantly in groups, regardless of our age group, right? Whether we are 60 or whether we are 20, we are living in a group all the time, whether it's family, friends, with colleagues, or we're constantly being in group settings. So I do think group work is going to be relevant across all age groups.
Right. Now, coming back to the Asian context again, because of the way that many of us are being brought up in our families, where, growing up, you get to have that thought that, okay, don't talk to strangers, don't mix with strangers, they can be bad people, don't get influenced by outsiders. So we tend to keep to ourselves or keep to a very close group of friends. Now, in group process, you are meeting sometimes even strangers for the first time. How does that impact, the ability for someone to actually open up to talk about very difficult issues and to articulate what they're feeling? Does it hamper, the group process?
Well, I do think that regardless of culture, from my experience in the States, working with colleagues from AGPA, I think everyone's bound to be anxious talking to a room or circle full of strangers. So that's definitely normal. And I think with the facilitation of the group leaders, to create this really safe circle, this safe space and container to talk about difficult things, even such as like, I'm feeling so nervous right now because I'm not quite sure if people are going to judge me for saying anything. And I think while this safety takes a bit of a time to build up, we will also want to acknowledge that it's perfectly fine to feel anxious.
Right. So the adage that we went on in the last couple of chats as well, saying that it's okay not to feel okay. So this is something that we should all be very comfortable with. Now, coming back to you, Nishta, growing up in Asia or Singapore itself, do you feel that there is a taboo or a denial in terms of being able to embrace and accept that there are mental wellness issues sometimes among family members or friends? Do you find that there's a taboo factor or just a complete lack of awareness and knowledge?
So I think the part where it's a bit of a taboo or stigma, there has been a lot being done locally, I would say, over the past few years. Very impressive. I think much of which is, of course, done I think a lot of work has been done by the president as well, kind of focusing on mental wellness. So we got to be thankful for that. So it's better than it was, but definitely there's a lot of improvement. So while people are aware, sometimes the gap is where people don't know what to do after they are aware of some of these issues, you see. So I like that question earlier you asked, Jamie, like this whole thing about, would people talk in a group? And the surprising thing is, people actually don't say very much to their own families. They only say what they think their family wants to hear. You give mom the mom version, you give dad the dad version, you give your friend the friend version, right? But then when you come to the group, surprisingly, sometimes people do share authentically, like they really share the raw version comes out in a group. You see, because you don't have to safeguard another person's feelings. You don't have to be proper for your dad, for example. You don't have to be the fun friend. You can just be you, because nobody knows who you are.
Right.
So
that's a very interesting. That's a very interesting share, because I think one of the things that we had discussions of previously as well is that sometimes the problem starts off with the family members itself. Convenient for you to say it out loud in the family. That's interesting that people are actually willing to articulate the feelings and the true raw feelings. So I think that's a good sign.
And I think, Jamie, just to piggyback what Nishta have said, the thing is, being in a group, it's really a reflection of the world outside. Like we might, it's kind of in a way that it's safe, while it's still a microcosm of what reality is. So there's going to be someone in the group that's going to feel very familiar like your dad. Or someone in the room that's going to feel like your best friend that makes you feel safe. So feelings like that often it parallels in the group. And I think that's the thing about being in group therapy, is that we're really trying to help people feel safe in the group while saying the things and being true to themselves in the group, and try out, I think, new interpersonal behaviors that they've always wanted to, but haven't done so.
So I guess it's really important as facilitators then to make them feel safe, that there's no judgment. I think that helps. Coming back to you, Shi Min, you spend a large time working with people from the US. Do you feel that it's a very different way of, a different level or rather of awareness in the US, say, versus in Singapore? and whether people in the US are probably more aware of what they can do to help themselves or the people around them compared to, say, in Singapore or in Asia?
Well, I do think that it might vary from person to person. One thing I do realize is the language use. I realize that how it's so important to be able to put our thoughts and feelings into words, whereas it's less so in Singapore. But because the thing is, when we want to give constructive feedback, say for example in a group, right? So we want to give constructive feedback, like, oh, when you say this, it makes me feel yada yada yada. But language like that, it's seldom used in I would say people around. Whereas I think in different country, maybe putting forth things like that might sound as a constructive feedback, whereas it might be perceived in a different way depending on the tone used, which is why in group therapy it's so important for the group to help give feedback to each other about the way we are giving, we're talking to each other, relating to each other. So I do realize that that's the slight difference in terms of putting thoughts and feelings into words.
Right. It's interesting sharing. Nishta, coming back to you then. What is your advice then, you know, apart from people who have really taken ownership that say, okay, say I've got depression, I need help, I can't cope with it alone, my friends can't help me, I need to take it to the next level, I need to see a psychologist. But then there are people who are in between, they're trying to seek help from friends, but they don't want to go to a psychologist. What is your advice, Nishta? What should these people do if they're suffering from addiction or, you know, having bad thoughts about themselves and things like that? What should they do?
I think the most important thing is to try, at least try and seek help, and know that the first step is to actually come in to actually seek professional help, because there are limitations by family members and friends as well. A lot of individuals who come in sometimes say, I don't want to burden anybody, you see. And that's where then with depression, we see a lot of withdrawal from social circumstances and gatherings, you see. So the first thing is to kind of come in to just try and see how it feels like to actually get help. So help is two ways. One is, of course, psychiatric, you know, help and medications, perhaps, right? And then, of course, the other part is, of course, definitely having counseling or therapy, you know. And there are various forms of therapy that somebody can kind of opt for, you see. There's art therapy, there's music therapy, there's like counseling, there's family therapy, there's like abundance, and then there's psychotherapy as well, you see. So there's a lot of options now, you see, for somebody to kind of explore. But the first step is to kind of go in and to try and see how it goes. Yeah.
You gave us some very, very precious advice, especially for people who are feeling the stress. So in 2020, this year, I think a lot of us will agree it's not a fantastic year for most of us. We wish it never happened. But because of what has happened, a lot of us are undergoing a lot of stress in our workplaces, retrenchments, you know, business closures, social distancing, yada, yada, yada. Would you agree with me that there is a trend or a spike in terms of cases of depression in Asia? Right. And so in your point of view, I mean, you guys are clinical psychologists. What is the rising concern right now? Is there a rising trend in Singapore or in Asia in certain types of cases? Share this.
I think an article just came out in the Straits Times today. I think the number of people reaching out to seek help from mental health services have definitely risen in the past few months. And I think undeniably, I think COVID and the subsequent circumstances led by COVID has been quite a trigger for many people in terms of coping with the uncertainty.
Right. Nishta, what's your opinion?
I think it's very interesting, this whole COVID situation, because there we go. We have a pandemic where everybody is going through some form of uncertainty, some form of suffering in their own way, some form of change, and everybody is kind of going through it. So for the first time, we have a situation where everyone seems to be in a bit of a fix in their own, you know, small little ways or very big ways, you see. The other thing is that what we see is that with the work from home arrangements, which was not only in Singapore, but worldwide as well.
Right.
I think there was a lot of shared spaces that have not been shared before. So suddenly you're stuck in the house with your husband, and then you're like, I don't know what to do with you, you know, like, why are you communicating with me in this way? Why are you in my space? You know, it's like, it changes a lot of dynamics in that sense, you see. And it gets you to kind of think about certain things that perhaps you have not spent too much time with. So there's a lot of reflection work that sometimes needs further reflection, and maybe that's why people sometimes seek us out as well, you know. Yeah, and there's shared spaces, and there's also isolation as well, like the sudden feel of being isolated. And there's this other point where people sometimes have self-care out of the house rather than within the house. So suddenly all your self-care methods have gone down the drain, and then you're left to kind of deal with self-care in other new ways, you know, that you have to kind of come up with, you see, as the government quickly starts to kind of change their own, you know, agenda, then you have to kind of come up with new ways as well. Yeah.
I must say a lot of us truly are confronting new issues that we never had to think about before. So it does put a lot of stress on relationships and the things that we are doing. So that's a very good point. Now coming back to both of you, because you guys are clinical psychologists, what are some of the signs that, you know, people like us should take notice of, and family members or friends or even colleagues at work, that they need help? What are some of the signs that we can sort of pick up and sort of like try to intervene, take the first step?
I think for most, we definitely want to acknowledge how everybody would present with distress differently, especially so I think when we talk about children versus elderly versus adults, I think we all express our distress in very different manners. So like, for example, children, lots of the times we do see them presenting in a more like a somatizing kind of like a presentation. So things like not wanting to go to school when they're saying that I have a really bad tummy ache, right? Or that could possibly be hinting signs of anxiety for the kid. As well as for elderly, we do also notice that they tend to present in more physiological forms. And I think definitely based on personality, it would look a little bit different from person to person. But I don't think the first step for any family or friends noticing that their loved ones is slightly off, looking a little bit troubled, is to just check in and ask, and also to definitely to normalize and to validate their emotion first. I think that's first things first.
Right.
What do you think?
Yep. Thank you so much. That's a very good tip. So what about you, Nishta? What are the signs that you sort of tell people to look up for if someone's in trouble or not getting well?
Because of the intricacies of all the mental health conditions and mental wellness as a whole, like some people prefer to be left alone, some people need entertainment, people around them. So everyone seems to react in such different ways. Sometimes it's tricky. But I think if people do notice that the loved one is is somewhat acting out of character, then one of the most important things I think to do is to seek professional help as early as possible, and to kind of convince them to kind of do it, you see. Because sometimes the advice giving can come across as being too imposing, and sometimes parents or loved ones try and be, you know, try and care for the person and try and be a therapist, or, you know, try and be a counselor, and like sometimes it gets too much, you know, you're wearing too many different hats. Sometimes it doesn't really work too well, you see. So in order to ease that, then to kind of come in for professional help early would be actually very helpful. And if they can get that person through the door, that will be amazing. Yeah.
Getting that person through the door, I agree with you. That's something that, you know, sometimes quite hard to get persons to agree to go for, you know, counseling. Now, on the second day of our National Counselling and Psychotherapy Conference, which is the 11th of November, your session will be at 1:35 p.m. Now, should you tell us a little bit more about the session where you and Nishta will be talking about?
Well, I think Nishta and I are really excited to be holding that particular session, because it's is a session that's based on experiential learning. And we have always felt that experiential learning is probably one of the most effective ways of therapists understanding more about group process and process groups just in general. Because so in that session, you're gonna have a slight tease. Like that session, we're gonna have a little bit of a spiel of process group, the theories and stuff. But the bulk of it, we're gonna be running a live demonstration of a process group. So attendees do have a chance, an opportunity to be sitting in the shoes of a group member and really experiencing how does group process feel like, and really going through, hopefully, really going through how the mechanism works, how group facilitators frame these sessions and things like that. Yeah, and we'll be doing a debrief and people can ask us Q&A about the
That's
sessions.
interesting. So Nishta, what will you be sharing with us on the day itself?
On that day itself, I think I would be sharing myself and my presence, and it's so experiential. It's hard to kind of predict, what we're going to do. It's like riding a bicycle. You can read about it, you can watch it, but at the end of the day, you have to get on that bicycle and ride it to know how to ride a bicycle, you see. So I'm really looking forward to kind of running the session with Shi Min, because we've run many different kind of sessions before. So this is going to be exciting. This is the first time we are going to be doing it online, virtually. So we definitely look forward to doing some of this work, very meaningful work. So that said, Shi Min and I have also both been part of process groups. And that's why we are advocating for it so actively, because in order to be a very good group therapist, group psychotherapist, then you have to be a group member to learn how to do this. And that would kind of create a better therapist. Yeah, we firmly believe in that.
Awesome. Now, based on your sharing, Nishta and Shi Min, you got me really excited too. I guess can't wait for the day to happen. So for all of you guys watching out there, National Counselling and Psychotherapy Conference takes place from the 10th to the 12th of November. It's just 3 short days. It starts every day about 9 a.m. Singapore time, ends off about 3:30 p.m. So please make time. It's a really great gathering of all our practitioners, psychotherapists and counselors and positive psychology applied people. It's great. I mean, you get the really great people coming together to share their thoughts, their practices, as well as the case study. So please come and join us. The website is nationalcounsellingconference.asia. So we'll see you there. Thank you so much, Nishta and Shi Min. It's been a pleasure to have you chat with us. And I look forward to day 2.
Thanks, Jamie.
Thank you. Thanks, Jamie.